Hi, I'm Dr. Winnie and I want to talk with you about my hair restoration program. Hair loss is one of those things that most all of us experience, and it can be devastating. It can cause you to have low self-esteem, just not like the way you look, and it can really affect the quality of your life. In my practice, we do a complete evaluation of the patient so that we can find out exactly what's going on and how we can best help you. That involves a good extensive history about you, about your family, your genetics. We may check your hormone levels to see if maybe that could be causing it. We also know that a lot of it has to do with just lifestyle. It could be that you have a lot of stress, it could be post-pregnancy hair loss, it could be a nutritional problem, it could be that you are doing things to your skin and to your hair that's causing the hair loss, whether it's bleaching, over-processing, hair weaves, braids, twisting. All of these things can take a toll on the hair. Now, in the past, hair transplant has been the way in which we've addressed hair loss, and it's very effective, but it can be pricey and it can also be rather uncomfortable. And recently, we've come up with ways to address hair loss that is more affordable and also really restores the hair that you've lost. Now, the first thing that we want to do when we're looking at the scalp is to look for hair follicles, because that's where hair grows. It grows out of a follicle. And so we use high magnification to look at your scalp and see where there are follicles. Now, if there are areas where there are no follicles, but you want hair there, you're going to have a hair transplant. But where there are follicles and they're open and active, that's where we can really make a difference. Now, one of the things that we do here as part of an overall comprehensive approach to hair restoration is use exosomes. And we use a particular type of exosome that works very well for stimulating hair growth. These are kept frozen, they're defrosted, and then they're mixed with normal saline, put in a syringe, and then that syringe is then used with its tiny little needle to inject under the skin. And what we're doing is we're flooding that area with exosomes. And what these do, they really do a wonderful job of communicating from one cell to the next, giving information to stimulate hair growth, which is exactly what we want. In addition to that, we use my hair product line, which is designed to nourish the scalp and promote hair growth. I have a cleanser and a conditioner and also a hair growth serum. Using this on a regular basis also helps to contribute to hair regeneration. Then we use Viviscal Pro. Now, this is a prescription brand of Viviscal, different and stronger than what you can buy over the counter. It's designed to really nourish the hair and to promote hair growth. And then finally, we use a laser cap. This uses red light therapy. Now, we know that red light, when applied to the scalp, is very effective in helping to stimulate hair growth. So we put all of these together along with any other medical treatments that we might need. For example, if you have a thyroid problem, we may need to restore that thyroid level back to where it should be. Any nutritional deficiencies, we would address that. But when we put all of those together, we give you the best opportunity for hair growth and regeneration, thickening of the hair, the diameter of the hair shaft, and also the growth of the hair. If you'd like more information, call my office.